Namaskar dosto, good evening friends. I am Dr. Sanjay Kalya, your friendly and familiar endocrinologist. And you're watching Dr. KK's Med Talks, Mondays with Dr. Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 1006वां 106th एपिसोड है. Let's have the headlines for today. Now, the global probiotics market is anticipated to reach a staggering $78.3 million level by the year 2026, with a compound annual growth rate of 6.8%. अब ऑनेस्टली 80 बिलियन और मिलियन नहीं बिलियन था अभी बिलियन $80 बिलियन में कितने रुपए हैं ये तो एक्चुअली मुझे गिनने नहीं आते अरब खरब. A team based in Italy conducted a pilot trial in which they sequenced the gut microbiome of people with irritable bowel syndrome. And they found that an individualized combination of prebiotics, probiotics, and antibiotics improved symptoms. Another editorial published in the Nutrients Journal has described the benefit of consuming nutrients and pre-probiotics for cardiovascular and renal health. तो इसका मतलब ये जो प्री और प्रोबायोटिक्स हैं ये पेट की या आंतड़ियों की सेहत और हार्ट और किडनी सभी की सेहत के लिए फायदेमंद है. They've also been found to have a remarkable ability to prevent dental caries, तो मुंह और दांतों के लिए भी फायदेमंद है. And a few foodstuffs, including onions and dandelion greens, are the top prebiotic-rich food sources. Of course, India में तो भरमार है foods की pre and probiotic. But let's see what our topic is for today. आज का topic देखते हैं क्या है. So no surprises, हमारा topic ही है pre and probiotics. तो अब ये prebiotics, probiotics ये अल्फाज क्या हैं? Let's have our expert introduce them to us. So a warm welcome to Dr. Nikhil Nagpal. Warm welcome, sir.
Good evening, everyone. Good evening,
Good evening,
sir.
Dr. Nikhil. It's great having you on this show. बहुत सारे लोग logged in हैं. Dr. Nagpal is an MBBS and MD Pediatrics from some of the most prestigious colleges in the country. And now he works as a registrar at the esteemed Lady Hardinge Medical College and Kalavati Saran Children's Hospital in New Delhi. He is also a volunteer faculty member at Lift for Upliftment. ये एक NGO है जो फ्री कोचिंग देती है अंडर प्रिविलेज स्टूडेंट्स को जो MBBS की तैयारी कर रहे हैं. एंड डॉक्टर निखिल नागपाल की जो कमिटमेंट है टू हेल्थ केयर एंड टू एजुकेशन दैट एग्जेम्पलीफाइज मॉडर्न इंडिया, विकसित भारत. ऐसे ही हमारे जो प्रोफेशनल्स हैं जो हेल्थ केयर और एजुकेशन दोनों में अपनी सेवा देंगे तो सर्टनली हमारे देश का भविष्य जो है वो उज्जवल है. वार्म वेलकम सर.
Thank you so much, sir. I just want to extend my thanks to you for giving me an opportunity to give a talk on prebiotics and probiotics.
We are happy to learn. डॉक्टर निखिल, लोग ग्रीट कर रहे हैं आपको. स्वप्ना जैन मैडम जी वेलोर तमिलनाडु से एंड श्यामा चाइल्ड केयर सेंटर ऑल ग्रीटिंग यू. एंड अब आजकल इतनी बात होती है अबाउट प्रीबायोटिक्स प्रोबायोटिक्स, तो इफ यू कुड यूज योर स्लाइड्स एंड शेयर विद अस. तृप्ति तनवानी जी भी पूछते हैं आप हमें इन वर्ड्स के मतलब समझा दें पहले क्या होते हैं. एंड ये हेल्थ का हिस्सा है, साइंस का हिस्सा है या ये सूडो साइंस का दर्जा लेती हैं चीजें?
Yes, sir. So can I have my slides, please? So this is going to be the outline of the day, from introduction to history on the concept of probiotics, the mechanism of its action, the examples of certain probiotics, naturally as well as commercially available, then the prebiotics, their examples, the clinical applications, symbiotics, and the current status of probiotics in India, and references. So as I read out this line that intestine is a paradise of disease, death sits in the bowel, bad digestion is the root of all evil. I recall one of my professor, he used to say on rounds when we used to present our rounds to him that the child is having this issue, the child is having this issue. He used to ask whether the child is able to take orally. If the child is able to take orally, assimilate his or her food, and is able to pass feces and pass urine, he used to say that we are not in that bad order. So bad digestion is the root of all evil. History of probiotics. Now, actually, the concept of probiotics was given in our Ayurveda only. the panchkarma. But at the in the allopathy at the start of 20th century, Russian Nobel Prize winner and the father of modern immunology, Allen, a scientist at Pasteur Institute, he was the first who conceptualized the science and medicine of probiotics. In early 1930s in Japan, Minoru Shirota, he developed fermented milk product which is called Yakult. It contains a special strain of Lactobacillus shirota. It is commercially available also, and has undergone clinical trials that we'll discuss later on. Let's understand what actually probiotic mean. The word probiotic is derived from two dead languages, that is Latin as well as Greek. Pro means for, and bios means life. So it was first used to indicate substances that were required for a healthy life. Initially, the definition which was given was that probiotics are the substances which are basically produced by the microorganisms, and they help in the growth of the other microorganisms. The word probiotic was coined in the year 1965 by Lilly and Stilwell. Now, this is on 12th February 1965. Lilly and Stilwell, they first described probiotics as growth promoting factors produced by microorganism. That is, the substances which are produced by microorganism help in the growth of the other microorganism. Now, how WHO defines probiotic? According to WHO, probiotics are live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. I just want to underline two things over here, that they are live microorganisms. And second important thing is they have to confer health benefit to the host. So there are a lot of commercially available products in the market which basically promise that they confer some health benefit. Only those which have been tried and tested and they confer health benefits, they are actually considered as probiotics. Otherwise, there are certain substances like on which it is written that they boost the immunity, they do this and that. They will not qualify as probiotic. As probiotic, they should confer a certain health benefit to the host. This definition was given by WHO and was endorsed by FAO also, that is Food and Agricultural Organization. Now, the facts about intestine. Now, our intestine has around 100 trillion microbes. That is, they contribute to around 3 million genes when studied in next generation sequencing. Now, how are these intestinal microflora distributed in our gut? Now, as we go proximal to distal, the concentration and the amount, the diversity of microbiota, it goes on increasing. Like if we look at stomach, the microflora is in the order of 10 to the power 3, that is 1000 per ml. But as we go down and reach the colon, the microorganisms are to the concentration of 10 to the power 12 per ml. Now, why does it happen so? Because there is increased transit time. There is increased gut motility in the proximal intestine, and there is sluggish peristalsis in the distal intestine. So they have more time to thrive in the distal intestine. Now, since there are these microbes, they contribute to about 3 million genes. Therefore, intestine is known as second second genome. And they also basically contribute to the neuroendocrine, basically hormonal system, that as we will discuss further. That is why it is also known as second nervous system and second endocrine system of the uh, body. It is well discussed in an article of Kalra sir only, gut guardianship. Now, it is an interesting fact that we have 10 times greater number of of these microbes than our own somatic and germ cells. We carry a huge load of basically microbes in our body to the tunes of 2 kg. And we have a very diverse basically we have very diverse population of microbes in our body to the tunes of 300 to 1000 species. And 30 to 40 species, they form the majority of the flora, and among them they are lactobacillus, bifidobacterium, and acidophilus. Now, since they are a lot, like our body, 2 kg of our body is microbes. Now, what is the like utility of them in us that we will now study? Over here, I just want to ask whether intestinal microflora or gut microbiota contain only bacteria, or does it contain other basically primitive organisms as well? So yes, uh, fungi and viruses, mainly the bacteriophage, they also become a pivotal part of our gut microbiota. Now, what is the mechanism of action of probiotics? Now, uh, now these basically probiotics, they are the microorganisms. Now, these microorganisms, they feed on the indigestible fibers or microbial accessible carbohydrate. These indigestible fibers are known as microbial accessible carbohydrate. These microorganisms, they feed on these microbial accessible carbohydrates, and they convert them to butyrates and acetate, which are the short chain fatty acid, SCFA. Now, these basically byproduct, that is short chain fatty acid, they are very important for our gut health. That is, they help in the survival of colonocytes, as well as they are also like an important uh, important uh, important substance for our liver also. That is, they basically decrease the synthesis of cholesterol. Now, these gut microbiota, they form a basically gut barrier in the inner lining of the small as well as the large intestine. Now, since the lining of the intestine is basically uh, is occupied by these microflora, so the pathogenic organism, that is the pathobionts, they are not able to occupy this space, so they basically form a gut barrier also. Now, these microflora, they also help in the proliferation of this epithelium of the gut. They not only help in the proliferation, they also regulate and keeps the proliferation in check. That is why it is said that these probiotics have also anti-cancer properties, anti-colon cancer properties. Now, as I said, that they are lining the basically gut. So the pathogenic organisms, they cannot basically they cannot find the space, they cannot find the receptors to enter in. So they basically act as a gut barrier. More than that, more than that, they also stimulate the T regulatory cells in the host. So these T regulatory cells, as we know, that they keep the T effector cells in check, they keep the inflammation in check. Therefore, there is less of the inflammatory milieu in our body, in the gut as well as systemically, and there is more of anti-inflammatory milieu, that is interleukin 10, TGF beta. They are increased because of probiotics. Because of this hypothesis only, that they stimulate the T regulatory cells and keep the inflammatory milieu in check, it has been suggested that these probiotics have a role in rheumatoid arthritis or in other condition in which there is increased inflammatory milieu in the body, like asthma, like atopy, allergy, in which there is increased inflammatory milieu in the body. The in like IBD, like ulcerative colitis, like we all know that these microorganisms, they also help in the production of vitamin K. Therefore, they help in maintaining the coagulation system, homeostasis, and they also help in the production of vitamin B12. Now, they also have a role in enteric infection. As we will discuss the guidelines, we will see that in enteric infections they have a role. One thing is that the pathogenic organism will not be able to find its receptor. Second important thing is they when the pathogenic organism finds its way into the gut, they release bacteriocins. These bacteriocins are nothing but these are the antimicrobials or the antibiotics that kill the pathogenic organism. Moreover, these bacteriocins, they help in the proliferation of the good basically bacteria in the gut, that is lactobacillus, bifidobacterium. So that's how they basically strengthen our basically immunity as well. Moreover, they also have got a role in basically in IBS, irritable bowel syndrome. How? Because they in irritable bowel syndrome there is visceral hypersensitivity. They decrease. They basically decrease that hypersensitivity. So they check that hypersensitivity. That's how they also are. They also have a role in irritable bowel syndrome. So this table basically describes that probiotics, they have main three roles in maintaining the normal intestine, in immunomodulation as we discussed by forming a barrier, as well as keeping the inflammatory milieu in check, and certain metabolic effects by forming by producing vitamins. They all uh, they also basically help in the digestion of lactose. So in lactose intolerance patients, probiotics are of basically help. And also we have discussed that butyrate, it decreases the cholesterol synthesis in the liver, so they also help in lowering the cholesterol and thus have a role in improving the cardiovascular health as well. So we can see that probiotics or the gut microbiota, it has got so many roles. Moreover, these uh, microbes, they basically uh, they form this butyrate and the acetate. They regulate the CNS, the neurotransmitters, and some years back, it has been shown that it has got a role in autism, ADHD, mood stabilization, depression, and more so often it has been found that it is also helpful in multiple sclerosis also. So it's got so many roles. Next is, what are the factors that affect the gut microbiota? It starts right from the birth. If we are born vaginally, we will have more of the vaginal microflora of the mother, as well as certain skin commensals also in our gut microbiota. If we are born by cesarean section, we will have more of skin commensals in our gut microbiota. There was a study like published 5 6 years back, which showed that the patients who are born by cesarean section have more incidence of inflammatory bowel disease than the ones who are born by vaginal delivery. It is basically postulated that the patients who are born by vaginal section, they have more they have like a higher diversity of the microorganisms in their gut. So that's how. Then is the feeding practices. It has been shown that the breastfeeding is like rich of prebiotics. We will see that colostrum is like full of prebiotics. Even later, the mature breast milk is also rich in prebiotics. So the feeding practices, if an infant is fed with breast milk early in the infancy, he will have more diversity of gut microbiota than the infant who is fed with formula milk or animal milk. So the feeding practices also determines like what kind of microbiota we will have. Now later in the life, broad spectrum antibiotics, they they basically indiscriminately kill all the bacteria, pathogenic as well as our commensals. PPIs, that is proton pump inhibitors. Now, these proton pump inhibitors, like they will inhibit the growth of acidophilic commensals. Then metformin, NSAIDs, these all have an impact on the gut health. Also, they decrease the diversity as well as number of gut microbes. Now, the diet, which is very highly processed and contains less fiber, like the burger or the street food, they will also it will not provide the substrate for the gut microbes. Like the substrate for our gut microbes is fibers, the starch, so fermented products. So the diet which is low in all these constituents, they will hamper the growth of the gut microbiota. It has also been seen that the rural population, they have more diversity of, and the more number of microorganisms in their gut than the urban population. And it has also been seen that the females have more diversity of the microbiota than the male population. The they stress basically decreases the microbiota. Smoking and alcohol, they also have a negative relation with the gut microbiota. It has been postulated in many of the articles that I read that exercise increases the gut microbiota, but in many of the studies, diet was a confounder, because the one who like regularly exercises is bound to have a good diet also rich in fibers. This basically graphically shows that the ones who are breastfed, they have uh, bifidobacterium, that is the gut friendly bacterium, in like good amounts than the ones who are formula fed. So the so we have basically friendly bacteria forming the lining of the intestine, and the unfriendly bacteria. When the friendly bacteria decrease in number, unfriendly bacteria, they find their receptors, they find a way. Now, what is dysbiosis? So this was the normal basically ecosystem of the gut. Now the dysbiosis is, there is an abnormal microbial colonization by the unfriendly bacteria, or the friendly bacteria, they are not in the right proportion. They have either increased, or one of the like bacteria or one of the microorganism has disproportionately increased, and the other microorganism has disproportionately decreased. So it is not कि dysbiosis है तो इसका मतलब कि कोई pathogenic bacteria ही है. Even if the gut microbiota is not in the right proportion, this also qualifies for dysbiosis. So we just saw that there are some of the important causes of dysbiosis. That is a rampant use of broad spectrum antibiotics, certain autoimmune conditions also, which increase the like inflammatory milieu like IBD, and other basically the modifiable risk factors include our food habits, stress, and alcohol and cigarette smoking. Now dysbiosis in certain basically disorders, and it also tells like that gut microbiota plays an important role in maintaining all these. In obesity, the firmicutes are increased in number. So if the firmicutes are higher than the other friendly bacteria, there are chances, or there is a predisposition to obesity. Now the gut health is important for sugar homeostasis also, because uh, uh, dysbiosis can lead to diabetes also, not only type 1 diabetes but also type 2 diabetes. Why? Because in type 1 diabetes, if there is a dysbiosis, that means anti-inflammatory milieu will be less, inflammatory milieu will be more. And if there is more inflammatory milieu systemically, it will lead to it is postulated that this is how it is correlated with type 1 diabetes. In type 2 diabetes, the association is because the butyrate and the acetate, which are the short chain fatty acids, which are produced as a result of like microbial action on the indigestible fibers in our gut. Uh, these butyrate and the acetate, they decrease the insulin resistance. That's how it has been postulated that this is how it is associated with type 2 diabetes also. In colorectal malignancy, we just saw that these butyrates and this gut microbiota not only helps in the uh, proliferation of the epithelial cells, they keep the proliferation in check also. So that's how it results in colorectal malignancy. And it has been seen that the E. coli, the bacillus, they are increased in colorectal malignancy, as well as staphylococcal galactolyticus. Now it has been shown that this gut microbiota, the entire, is obligate anaerobic in nature. Some facultative aerobes are found in the cecum, but by and large, it is like anaerobic in nature. So if we see facultative aerobes like E. coli, Bacillus, and Staphylococcal, so increase in number, then it basically postulates that it may lead to colorectal malignancy. In IBD, just we saw that Enterococcus fecum and Proteobacterium, which are also normally found in our gut microbiota, but if they are increased in proportion, it has an association with IBD. Now, now recently it has been shown that by giving E. coli nasal, we can achieve remission we can use in the remission maintenance of ulcerative colitis patient, and VSL3 it can also be used in mild to moderate flares of ulcerative colitis. Now, the inflammatory milieu is also increased in Crohn's disease, but probiotics have not shown to be helpful in cases of Crohn's disease. In IBS, that is irritable bowel syndrome, we just saw that the facultative anaerobes, that is E. coli and the firmicutes, they increase in proportion as compared to the other friendly bacteria. Then another condition is NAFLD, uh, non-alcoholic fatty liver disease. Uh, mm, for some time back, we saw that this gut microbiota is not only good for the gut health but also for the liver health, the butyrate and the acetate. So they basically are good for the liver also. Moreover, when there is a dysbiosis, there is less of the friendly bacteria and more of the pathogenic bacteria. Lipopolysaccharide and ethanol are basically produced by the pathogenic bacteria, and they have been attributed to be associated with NAFLD. As I describe this NAFLD, I remember of a case of Otto Brewery syndrome. It is basically mentioned by Tiny Nair sir, who is a renowned cardiologist in the South. He described a case of dysbiosis, that there was a 46-year-old gentleman in London. Uh, he had basically complaints of intermittent aggressive behavior and change in behavior. He used to get aggressive, throw stuff, used to abuse people, and there were intermittent bouts of it. He was properly investigated, and his alcohol level was found to be like like above the lower limits. It was significantly higher than the lower limits. So he was asked the history, that whether he has taken ethanol or alcohol anytime like before. He used to always basically say he used to always refuse that he has not taken any alcohol. So later on, it was found that he was having dysbiosis. There was production of alcohol in his body, especially when he used to have some street food, when he used to have some pasta or the pizza. So the pathogenic bacteria, they used to act on them and used to produce ethanol. And uh, so this was a case of Otto Brewery syndrome described by him. He was given a course of probiotics in the adequate amount for 10 days, and he was like cured of Otto Brewery syndrome. So generally, Otto Brewery syndrome, I just mentioned it because the pathogenic flora producing ethanol can lead to NAFLD and can also lead to Otto Brewery syndrome. Then celiac disease also. Celiac disease, again, the inflammatory milieu is more. There is more of proteobacteria proportion as compared to the other friendly bacteria. In the cardiovascular, we just saw that uh, the choline is converted into trimethylamine oxide with the help of the pathogenic bacteria. So, and it is responsible for atherosclerosis. So, dysbiosis may lead to the cardiovascular complication or premature atherosclerosis also. And asthma, atopy. Two hypotheses have been described. One is the hygiene hypothesis. It states that, like I read an article in which they had mentioned that the ones who have pets in their homes in early infancy, they have less chance of allergy, less chance of atopy, eczema, asthma later in life as compared to the ones who are exposed to the pets in their early life. Because of the hygiene hypothesis, if like we are way too hygienic, that also leads to less diversity of gut microbiota in our body. And also the western pattern diet consisting of more processed foods and less of the fibers can also predispose to asthma because of dysbiosis. Now, we just saw that probiotics are not only important for our gut health, but our overall health and overall well being. Now, we just saw that the important risk factors for dysbiosis include antibiotics, alcohol consumption, and stress. So, they will destroy the gut microbiota, make space for pathogenic organism, and the person is going to have problems in digestion, uh, in absorption of the nutrients like vitamin K, vitamin B12. So, what do probiotics do? The probiotics, that is the live organisms which are given from outside, they will replenish the friendly bacteria. So, we are exogenously giving those friendly bacteria. So, the pathogenic bacteria will go down in number. So, competitively, they will go down in number. The probiotics that are commercially available, there are some ideal characteristics they should possess, like they should be non-pathogenic, they should not they should not because there were some case reports that the probiotics were given and the patient developed sepsis, the patient developed abscess. So they should be non-pathogenic, non-toxic. They should be capable of thriving in the upper GI tract also. They should be resistant to the low pH in the stomach and also to the bile juice also. They should be human in origin. They should be genetically stable. They should be able to modulate the immune response as our own friendly bacteria do. They should be able to adhere to our intestinal cells and able to colonize also. They should also have antagonistic properties, like anti-carcinogenic properties like our own bacteria. And like the definition of probiotic only says, it should have clinically proven health benefit. If it doesn't have proven health benefit, it doesn't qualify for probiotic. It should be helpful in certain conditions like diarrhea, antibiotic associated diarrhea, or gastroenteritis or other disorders. So the examples, this is the lactobacillus and the Y-shaped bifidobacterium, the probiotics which are commercially available. Now, the food products which contain probiotics include milk, soya milk, tofu, then the milk products like buttermilk, yogurt, or curd. Now, there is a head-to-head conversion of curd with the buttermilk. Now, curd is dahi, and the buttermilk is the lassi or the chach that we like have. Now, there is a head-to-head convert, like which probiotic is better, whether we should take more of yogurt or more of buttermilk. Like both are actually good, but in head-to-head basically comparison, it was found that buttermilk has an upper hand over yogurt, because when you stir basically yogurt, then the cream is removed and the buttermilk is separated, so it has low fat contents. So in the cardiovascular dimension, it has like plus effect as compared to yogurt. So buttermilk by and large is considered uh, a little better probiotic as compared to yogurt. Then the fermented Indian foods like idlis, dosa, dhokla, vada, kadhi, they all basically contain probiotics. Now, while I was making the slides, I thought like, does heat not destroy the microorganisms present in these things? So yes, basically heat basically like up to a temperature of 65 degrees centigrade, like they can basically thrive well. But if the temperature exceeds 80 degrees centigrade, then then it loses its like probiotic properties in these conditions. So now we just saw in the first slide only the Yakult, which contains Lactobacillus shirota. It's like It's a probiotic, basically a drink available in the market. The clinical trials, they have failed to demonstrate long term basically effect of Yakult. It has been seen that it can be used in clinically diagnosed halitosis, clinically problematic halitosis. And the probiotics, that is the lactobacillus it contains, like from the tongue and the cheek scrapings, they had basically saw that the microbiota, that is the lactobacillus shirota, only remains for 2 weeks after the probiotic consumption. After that, it again comes back to the baseline value. So only for short term, it may basically help, but not in the long run. Then the commercially available, that is the lactobacillus, that is the lactic acid bacillus or the sporolac sachets. It contains lactobacillus, now in the order of 10 to the power 8 colony forming unit per ml. We will see like how are they basically, how are we justified in prescribing them. Then the Bifilex sachet, it contains many basically bacteria in it. And Wyback zinc sachet, which contain four basically friendly bacteria, that is the Streptococcus faecalis, Clostridium butyricum, Bacillus mesentericus, and Lactobacillus porogenes. And Enterogermanica, which is also available in the market, it contains Bacillus closispores in the order of 10 to the power 9 colony forming unit per ml. Now, we will see how they are commercially used. Next is prebiotics. Now, what are prebiotics? The concept came around 3 decades after the probiotics, in 1995 by Gibson and Robert Freud. Now, how did they define basically prebiotic? Prebiotic, अगर सिंपल सी लैंग्वेज में बोले तो ये फूड है जिसके ऊपर गट माइक्रोबायोटा फीड करता है और थ्राइव करता है और बाई प्रोडक्ट्स बनाता है जो कि हमारी बॉडी के लिए हेल्पफुल है. So these are non-digestible food ingredients, especially the fiber, that affect the host by selectively stimulating the growth and activity of one or a limited number of bacteria in the colon that can improve the host health. So these are basically probiotics, prebiotics. Now, the naturally occurring prebiotics include garlic, onion, asparagus, uh, wheat, rye, barley, breast milk, tomato, berries, and banana. They contain indigestible basically fibers, the raw material on which our gut microbiota act. Now, the established prebiotic include inulin, which is basically extracted from the wheat, banana, onion, garlic, fructooligosaccharides, which is basically obtained from sucrose, galacto-oligosaccharides, which is produced from lactose, soy oligosaccharide from the soybeans, xylo-oligosaccharide from xylan, isomalto-oligosaccharide from maltose, and pyrodextrins from potato or maize starch. As we discussed that breast milk, it contains, it has the third largest component of breast milk is prebiotic only, and it is present in abundance in colostrum and also present in the mature milk later on. Now, the clinical application of prebiotic, it was hypothesized that uh, like since it basically has so many effects, so it could basically benefit in diarrheal illness, prevention of antibiotic associated diarrhea, prevention of Clostridium difficile infection, in IBD, in lactose intolerance, in necrotizing enterocolitis, and some other suggested benefits that were basically prescribed were food allergies and eczema, the conditions in which there is an increased inflammatory milieu. It also holds promises in allergic rhinitis, asthma, colic in children, colon cancer prevention, obesity, hypertension, cystic fibrosis, and cardiovascular diseases, in rheumatoid arthritis, and in genitourinary tract infections also. So, uh, antibiotic associated diarrhea. Like with the use of broad spectrum antimicrobials like ampicillin, cefixime, clindamycin. There is an antibiotic associated diarrhea which is seen in 5 to 30% of the patient. So probiotics use can help prevent this, as well as can be used as an adjuvant therapy in antibiotic associated diarrhea. So if we inadvertently use antibiotic, there is a disturbance of intestinal microbiota. There is clostridium overgrowth. So if we give probiotics, it will competitively inhibit the growth of the clostridium, and the microbiota imbalance will get corrected. So in lactose intolerance, which is like common in our belt, now, how does it help in lactose intolerance? Supplementation with the probiotics mitigates the symptom of lactose intolerance by beta D galactosidase enzyme, which is expressed by these microbiota. So, this enzyme helps in the digestion of lactose in the milk. So, having yogurt is a good way for lactose intolerant patient. Now, it also helps in H. pylori infection or gastritis or uh, peptic ulcer disease. The Bifidobacterium and B. subtilis may inhibit the growth or attachment of H. pylori. So that's how, like, Bifidobacterium can help as an adjuvant treatment in Helicobacter pylori infections. Then we just had discussed that it also helps in regulating the cholesterol levels in the blood, especially the lactic acid bacilli. And we also saw that probiotics have anti-cancer properties. So in head to toe, if we recall, it has effects in the brain. That is, it is helpful in autism, ADHD, stabilizes the mood, helpful in anxiety disorders, helpful in depression, also in multiple sclerosis. Then in the lungs, it is helpful in asthma. It also has got cardiovascular. It also has a cardiovascular protective role in ischemic heart disease. Then in the biliary disease also, in obesity and the metabolic syndrome, in type 1, type 2 diabetes, in the inflammatory bowel disease, IBS, and also in peripheral vascular disease. So actually, probiotic initially, like in 1965, is when it was basically proposed. It was used as a health supplement, so it did not require FDA approval. Like the product which was claimed to be probiotic had to basically had to be passed by Dietary Supplement Health and Education Act 1994, and they had to basically follow some good manufacturing practice guidelines, and they were basically released into the market. But when the concept came that probiotic can be used in disease condition also, then it was a time that FDA approval was required. But the problem is that probiotics have not been able to have FDA approval, because the exact strain, the number or the exact colony forming unit, which is which is helpful for the patient, is yet not been addressed. So the studies are lacking. So that is why it has not basically been approved by any of the probiotic has been approved by FDA. So because the probiotic effect is dose dependent. If we give inadequate dose or if we give excessive dose, both are like not correct. So uh, now, Indian Academy of Pediatrics, this is from my MD notes, like that there are some IAP recommendations for probiotics. That is, it can be used in acute diarrhea. There is a low to moderate basically grade evidence that it can be used in acute diarrhea in children from 0 to 18 years of age. If used, it has to be used for 5 to 7 days. And which species can which basically species or the strain is helpful is lactobacillus. And also in the order of 10 to the power 10 colony forming unit has been found to be useful. So though FDA has not approved, but IAP has endorsed it. or we can use Saccharomyces boulardii at a dose of 250 to 750 milligram per day. Combination is not to be used. Again, low to moderate quality of evidence. That is why most of the some of the clinicians, they prescribe it, and the others, they do not. The prevention of necrotizing enterocolitis. It is a complication in premature babies in whom the intestine is very premature, and on introduction of feeds, the intestinal necrosis, septic shock, intestinal perforation takes place. So this is necrotizing enterocolitis. It has been like it in pediatrics, if I say, one indication where it has got robust evidence, that is necrotizing enterocolitis. It has to be given for 4 to 6 weeks, for 1 to 1.5 month, and the combination should be preferred of lactobacillus and bifidobacterium uh, in the doses prescribed, that is 10 to the power 9 and 10 to the power 8 colony forming unit per day. So, but the problem is that the combination in this dosage is not available in India. So we can use lactobacillus, though the results are inferior in the same dose. It has got added benefits like it decreases the late onset sepsis, decreases the mortality, and it also decreases the time to achieve full feeds in the newborn. So they are more preferred in the human milk fed babies than the formula fed babies. Then is antibiotic associated diarrhea. There is no recommendation for routine use. Even routine use के लिए IAP भी recommend नहीं करता है. Only in two special situations we can use probiotics. That is, if the child has had two previous episodes of antibiotic associated diarrhea, or the child is very sick, the child has underlying chronic condition. So then basically special strains can be used. Like if the child has previous episodes or two episodes of antibiotic associated diarrhea, then lactobacillus or Saccharomyces boulardii can be used. But if the child is very sick, only lactobacillus has to be used. So so it has to be used throughout the duration of the antimicrobials. And then another indication is acute pouchitis. Now, as I just mentioned, that in necrotizing enterocolitis, uh, like it is a complication in the premature infants, it has been seen that the patients who have had necrotizing enterocolitis in their newborn period, they later on have poor neurodevelopmental outcomes. They later on turn out to be cerebral palsy or poor neurodevelopmental outcome. So it was seen that we are using these pro and prebiotic supplementation in preterm babies, whether it has got any effect on the neurodevelopment of these newborn babies. But the evidence as of now doesn't demonstrate any any uh, difference in the neurodevelopmental outcome between the ones who are treated with probiotics and the ones who are not treated. So this is what we used to use in our NICU settings, a Rescunate sachet. Now, in the antibiotic associated diarrhea, there are certain studies that I am quoting. Like these are for the adults as well as children. If used in adequate amounts, it has shown to decrease the incidence of antibiotic associated diarrhea. But uh, recommendation is not for everyone. Now, what are the adverse effects of using probiotics? Uh, yes, gas, bloating, mild digestive symptoms can happen. In immunocompromised patients, they can cause infections. Prebiotics have to be very cautiously used in the diabetic patients because already it contains sugars, fructooligosaccharides. And the probiotic products taken as a dietary supplement are manufactured and regulated as functional foods. So, are probiotic supplements necessary for all of us? They are not necessary for normal or healthy individuals. In healthy individual, daily consumption of probiotic rich food, dairy products like yogurt, it is like good enough to maintain a healthy digestive system and overall well-being. A diet high in starch and the fibers uh, provide prebiotic that basically helps in maintaining a good gut health. Then is the concept of symbiotic, like combining probiotic and prebiotic and using it as a food supplement. The benefit of symbiotic is that it increases the shelf life of the probiotic, and the benefit is that we are exogenously giving bacteria, and by giving prebiotics we are helping endogenous bacteria to proliferate as well. So what is the status of probiotics in India? Indian probiotic industry is in its infancy stage and presently accounts for only small fraction, that is 1% of the total market turnover in the probiotic industry. We are around 18 to 20% of the world's population, but our consumption of probiotic is less than 1%. Apart from human use, it can also be used as a animal feed supplements for cattle, poultry, and the latest addition is of Vibac that we uh, saw. It contains genetically modified Bacillus mesentericus, and it can be used as an alternative to B complex. Now, the institutes engaged in probiotic research in India, like two of them are in basically are in Haryana only, that is NDRI and in Panipat, and the other is Institute of Microbial Technology, Chandigarh, National Dairy Development Board in Gujarat, and also one in Mysore, that is Central Food Technology and Research Institute. They basically carry out the metagenomics, that is next generation sequencing of the bacteria, and they study its effect. The Human Microbiome Project, it was started and it was launched in 2008. It is aiming to characterize the microbial communities found at different sites in the human body, including the nasal passages and the oral cavities, and to analyze the role of these microbes in human health. Thank you.
Thank you, Dr. Nikhil. बहुत ही बढ़िया presentation. And Dr. Nikhil has spoken about the pre and probiotics in great detail. बहुत डिटेल में गहराई में जाके उन्होंने इसकी बात की है. And Dr. Nikhil, warm welcome to you, greetings to you from across the world. Tripti Tanwani madam ji, Ritika Khanna ji, hello kar rahe hain, and also Dr. Ermias Gebre Michel. Daksab is an endocrinologist in Ethiopia, and he is very excited that you've taken up this unusual but important topic. Bimla Kapoor Madam ji, Lalit Jalan ji, Ranga Reddy Lashkar Saab, and Manon Mani Sampath are also with us. Anamika Anuji bhi hain. And Dr. Gabriel Michel asks, sir is, like we said, an endocrinologist from Ethiopia. You spoke about drugs. Drugs have an impact on gut microbiota. It can be good, it can be bad, it can be neutral. So regarding metformin, would you be able to share a pediatric or adolescent perspective? Is there a chance that we stop using metformin in the near future?
Okay. Actually, the like use of metformin was associated with dysbiosis, but whether it is whether the positives and the negatives, whether the negatives outweigh the
Clinically,
positives is still a question.
in fact, when it comes to anti-diabetic therapy, acarbose has a much more significant impact on gut microbiota, which is supposed to be positive. Even within the alpha glucose disinhibitor class, acarbose has a greater effect. Voglibose has a much lesser effect on gut microbiota. This is actually thought to be an advantage for acarbose. With metformin and with the new GLP-1 receptor analogs, because they reduce our diet, our appetite, they also reduce the speed of gastric emptying. With these also, there is an impact on gut microbiota. But whether we will call off metformin in the near future seems unlikely, Dr. Mias, especially for Ethiopia and for India, because the drug is so economical and useful. But there is one, let's ask Dr. Gebre Michel a question. There is one cereal from Ethiopia, which is fermented food, which is very tasty, and it is gluten-free. So therefore, it is a preferred food of choice for people living with celiac disease. So our question to Dr. Ermias is, what is that staple of Ethiopia? You would like, if you could let everyone know, what are the different types of that staple? And how common is celiac disease in Ethiopia? Because in India, we have a strong latitudinal gradient. In the north, far away from the equator, Autoimmune diseases, including celiac, are more common. In the south, closer to the equator, they are much less. So we'll wait for Dr. Mias's answer. Dr. Nikhil, आपको ललित कथुरिया साहब भी ग्रीट करते हैं. He is a leading industrialist and a health advocate, health enthusiast from सोनीपत in Haryana.
जी,
And he says,
गुड इवनिंग।
अब हरियाणा की जब हम डिस्क्रिप्शन देते हैं तो हम बोलते हैं देशा में से देश मारा जित दूध दही का खाना. तो why is it that we say दूध दही का खाना and we don't say घी मक्खन मलाई या घी मक्खन टिंडी का खाना? So what is the difference from a health perspective between दूध दही and lassi on one hand and ghee and makhan and malai on the other hand? Advantages and disadvantages of both groups.
As I mentioned, that there was a head-to-head comparison of dahi and lassi. It was found that when you stir dahi and remove the cream, it becomes lassi. So lassi has less of the fat contents, so it has an added benefit in the cardiovascular dimension as compared to dahi. So there was a head-to-head comparison, and like the concentration of basically the microbes is also more in favorable of lassi as compared to dahi. अभी जैसे गर्मी भी है, so like having lassi uh, can have basically the cooling effect also in the body, and also uh, like provide us with probiotics, and in a way that they will also have beneficial cardiovascular benefits as well.
And this is something that is especially important for summer months. So it not
Yes,
only helps you in the probiotics, but also in or in the nutrition, but in hydration as well.
hydration.
रेखा बिठारा मैडम अनीता डडलानी जी से भी गुड इवनिंग आ रही है. एंड सरताज सिंह जी कहते हैं, सर सरल में समझा दो, अब हम खाने में ज्यादा क्या लें और क्या कम लें?
हमें खाने में फाइबर्स ज़्यादा लेने हैं, कि फाइबर्स अभी कितना लेना है फाइबर्स, उसके बारे में भी नेशनल इंस्टीट्यूट ऑफ न्यूट्रिशन ने बहुत अच्छे से एक्सप्लेन किया है. जैसे हम पीडियाट्रिशियंस कैसे बोलते हैं कि कितना फाइबर्स लेना है, जितनी उम्र है उसके अंदर 5+ कर दो, उतने ग्राम फाइबर लेना है हमें. सो जैसे अगर 5 साल का बच्चा है तो अराउंड 10 ग्राम फाइबर लेना है, और हम लाइक एडल्ट्स के अंदर अराउंड 20 to 30 ग्राम ऑफ फाइबर अ डे. नाउ जैसे 3 साल का बच्चा है तो 8 ग्राम फाइबर लेना है. अब फाइबर्स मिलता किस चीज़ से है? फाइबर्स हमें फ्रूट्स वेजिटेबल से मिलता है. अभी एक बड़ा फ्रूट जैसे एप्पल, पोमेग्रेनेट, ऑरेंज, एक बड़े फ्रूट में 4 ग्राम फाइबर होता है, और दो छोटे फ्रूट्स में 4 ग्राम फाइबर होता है. लाइक दो स्ट्रॉबेरीज में, दो पीच में, मतलब 2 2 ग्राम 4 ग्राम फाइबर होता है. 50 ग्राम अगर हम 50 ग्राम ग्रीन लीफी वेजिटेबल लेते हैं तो उसमें भी 4 ग्राम फाइबर होता है. और अगर हम एक ट्यूबर लेते हैं लाइक कैरेट, एक आलू लेते हैं, अराउंड 100 ग्राम वो कंज्यूम करते हैं, तो उनमें भी 4 ग्राम फाइबर होता है. सो अगर हम बेसिकली चाहते हैं कि हम प्रॉपर बेसिकली एक तो फाइबर्स लें, तो हर एक बेसिकली हर एक बेसिकली फूड आइटम से जो चार मैंने अभी डिस्क्राइब किया है, उससे अराउंड अगर हम एक-एक भी ले, 2 पीच ले लेते हैं, 1 सेब ले लेते हैं, 1 ट्यूबर ले लेते हैं और 50 ग्राम ग्रीन लीफी वेजिटेबल्स ले लेते हैं, तो अराउंड 60 टू 20 ग्राम ऑफ फाइबर्स उसी से ही मिल जाएगा. सो ये तो हमें फाइबर्स प्रोवाइड कर देंगे, रॉ मटेरियल प्रोवाइड कर देंगे फॉर द गट माइक्रोबायोटा टू बेसिकली प्रोलिफरेट और टू थ्राइव. और दूसरा, हम अपने डाइट के अंदर जैसे हमने देखा फर्मेंटेड फूड ले सकते हैं, लाइक योगर्ट, कर्ड, और इडली इज नोन टू बी एन आइडियल ब्रेकफास्ट. सो इडली भी हम अपने लाइक स्केड्यूल में इंकलकेट कर सकते हैं, एंड fermented food like pickles we can like incorporate.
एक और चीज जिस पे रिसर्च होनी चाहिए वो होनी चाहिए बर्तनों पे, यूटेंसिल्स पे जिनके साथ कुकिंग की जाती है. तो आपने देखा होगा वही मिष्टी दोई, वही दही अगर आप स्टील के बर्तन में लेते हैं या कांच के बर्तन में लेते हैं तो टेस्ट अलग है. बट एनीबडी स्पेशली फ्रॉम वेस्ट बंगाल वो आपको बताएंगे कि मिष्टी दही जो जो आप ये नॉर्मल पुराने बर्तनों में बनाते हैं जो मड के बने हुए हैं earthenware में, उसमें टेस्ट बिल्कुल अलग हो जाता है. So that's another thing to think about. What does earthenware do to the probiotics and prebiotics in a particular food? Ali Nazakit ji and Ashu Bhatli ji भी thank you कर रहे हैं आपको for the wonderful information you've given. And Vinayak Sharma ji and Sailesh Khyalia compliment you for a very well researched talk. So Dr. Armias responds from Ethiopia. The name is Enjera. The Enjera is the food, and we eat it the same way जैसे हम चपाती खाते हैं इंडिया में, सेम स्टाइल में एंजरा खाई जाती है इथियोपिया में. It's made of a plant known as teff, TEFF, and it's very good for gluten sensitive people. तो इंडिया में रूटीन में तो नहीं मिलता, बट यू कैन ऑलवेज ऑर्डर ऑनलाइन एंड सी, और ये बहुत टेस्टी है. एंड द फीलिंग यू विल गेट इज, जैसे हम मान लो डोसा खा रहे हैं. ओनली थिंग इज कि डोसा गरम गरम ठीक खाया जाता है. अगर आप डोसा ठंडा हो जाए तो इट्स नॉट वेरी टेस्टी, द इफ यू मेक इट आउट ऑफ राइस. बट ये जो टेफ वाला इंजरा है, ये ऐसे बना के रख सकते हैं, यू कैन ईट लेटर ऑल्सो. तो इट्स मच दैट एडवांटेज इट हैज ओवर चपाती एंड ओवर डोसा. आप इसको ठंडा या काफी टाइम बाद भी खा सकते हैं. Dr. M. A. Lambe and Anjali Sharma ji saying nice presentation and thank you very much for all that you've taught us. अब आपने बहुत सारी चीजें बताई. You talked to us about so many diseases where there is a promise of probiotics. But if you were to choose maybe the top 3 indications in pediatrics, जहाँ पे हम proactively probiotics देंगे, तो what would they be? The top 2 or 3?
न्यूबॉर्न पीरियड के अंदर नेक्रोटाइजिंग एंट्रोकोलाइटिस, प्रिवेंशन एज वेल एज ट्रीटमेंट.
Yeah.
Then acute diarrhea में there is a low to moderate evidence, but it can be used for 5 to 7 days, the commercially available ones. And some of the clinicians, they do prescribe Sporolac sachet, 1 sachet BD for 5 to 7 days. And the third is antibiotic associated diarrhea, especially in a sick patient in the ICU, or a patient having chronic basically disease like chronic condition. Like, so in them basically lactobacillus has got a promising role.
Adults में भी probiotics use होते हैं, and we have the concept of gut guardianship. So अंजलि शर्मा जी भी पूछती हैं,
Yes, sir.
sir, what does this mean to you? Do we need to guard our gut? आपने इतनी सारी बातें की. The gut is also the second genome, like you said. We also
Yes,
call
sir.
it the second endocrine system of the body, because all these
Yes, sir.
bacteria produce good hormones and neurotransmitters. It is also the second nervous system of the body.
Yes.
So, what does the word gut guardianship mean, and how can we use probiotics to protect our gut in from an adult or metabolic perspective?
So gut guardianship is that these microbiota, they are the guardians of the gut. And uh, like these
Many, many studies, though you can't have a very fixed black and white kind of advice for anyone. जैसे Love Humanity साहब पूछ रहे हैं, any specific role in diabetes, but this is certainly an important factor in metabolic health as well. बल्कि फीकल ट्रांसप्लांटेशन अब यूज होती है, वही जो पुरानी चीजें थी,
yes,
घूम
sir.
फिर के हम उनपे वापस जा रहे हैं.
In
तो
ulcerative colitis.
yeah,
Yes, sir.
fecal transplantation in diabetes as well, and in obesity as well,
Okay.
because people with obesity have different gut microbiome. Those who are lean have a
Yes, sir.
different one. तो ये ट्राई
Yes.
किया जा रहा है कि पतले लोगों के गट बैक्टीरिया आप लेके ओबीज लोगों में आप ट्रांसप्लांट कर दें तो शायद फर्क पड़ जाए. So no specific role, but if you have someone who has been on proton pump inhibitors for a long period of time, someone who has been taking a lot of antacids, someone who has been taking GLP-1RA for a long period of time, certainly there is going to be a change in gut microbiome, and in such situations it may help. Gut guardianship basically हम concept use करते हैं अपने लिए, जैसे antibiotic stewardship है, तो हमारा काम है, हमारी रिस्पॉन्सिबिलिटी है टू यूज एंटीबायोटिक सेफली. ऐसे ही सबकी pediatricians, adult physicians, सबकी रिस्पॉन्सिबिलिटी है टू टेक केयर ऑफ द गट ऑफ द एंटायर कंट्री. एंड वन ऑफ द वेज ऑफ डूइंग दैट इज द वे डॉक्टर निखिल हैज मेंशन्ड. आप अपने खाने पीने का ख्याल रखें, एंड जहाँ पे इंडिकेटेड हो आप जरूर प्री प्रोबायोटिक्स लें. So in children he has mentioned enterocolitis, antibiotic associated diarrhea, and in adults maybe prolonged use of gastrotropic drugs. So these are some of the ways where pre-probiotics can help. डॉक्टर निखिल, इट्स बिन ग्रेट. एक जो शुरू में एक कमेंट था डॉक्टर अर्मियास गैब्रे मिशेल का, वो ये था कि अ वेरी अनयूजुअल टॉपिक. सो why is this unusual? Khana pina, food is central to our life, to our existence. And why is it that we don't speak about such things? Is it considered effeminate in pediatrics to speak about food related things?
Since, sir, many clinicians, they do not basically prescribe probiotics because the evidence is very low to moderate quality. So it is not used in the clinical practice as such so rampantly. So that is why maybe.
Yeah. One thing I feel is, and now I've been in medicine for nearly more than 30 years, actually, not nearly, more than 30 years, uh, is that anything related to nutrition is considered kind of B grade, जबकि actually ऐसा है नहीं. हम सब लोग इकट्ठे मिलके अगर अपनी न्यूट्रिशन का ख्याल रखें तो सेहत बेहतर होगी. इसमें तो कोई दो राय नहीं है. There is no denying the fact that if you are well nourished, you will be healthy. The second thing is कि nutrition इतना बड़ा field है कि no single person, no single specialty can do justice to it.
Hmm.
Even within nutrition, nutritionists will tell you that they have different specializations, and it's difficult to keep pace with even one field of their vast science. ऐसे ही जो endocrinologist हैं, जो pediatrician हैं, adolescent medicine वाले, गैस्ट्रोएंट्रोलॉजी वाले, सभी का एक अलग-अलग नजरिया होता है. वही गट, वही आंतड़ियां, वही बैक्टीरिया, वही गट माइक्रोबायोम, बट एवरीबडी लुक्स एट देम फ्रॉम अ डिफरेंट पर्सपेक्टिव. एंड सही
Yes.
तरीका क्या है? अब मल्टी प्रिज्मेटिक, सभी लोगों का नजरिया लेके देखें. एंड वी आर ग्रेटफुल टू डॉक्टर नागपाल फॉर हैविंग हेल्प्ड अस. आपने डॉक्टर निखिल हमारी आंखें खोल दी.
Thank you, sir.
And we have Sriyan with us backstage. We'll request Sriyan to show a certificate of appreciation for Dr. Nagsal, please. Thank you so much, Dr. Nikhil. So, sir,
Thank you so
people
much.
listening to you from across the country, across the world, thanks to Dr. Armias for his contribution. But any take-home message before we conclude?
Take home will be like eat healthy, be healthy.
And that is a wonderful take-home message to take home. It's dinner time. अब खाने की बेला है. But Dr. Arpan Agarwal ji एक सवाल पूछ रहे हैं. Though normally we don't take trade names, but his question is this: acute diarrhea, which is better, Enterogermina or Econom?
Uh, okay, just a minute. In Enterogermina, Bacillus cereus is there, but Bacillus cereus, Bacillus has not proven to be helpful in either of the indications that I discussed, antibiotic, because in all the indications they had basically discussed lactobacillus, or so any probiotic which basically contains bifidobacterium and lactobacillus as such have a superior and an upper hand over any other uh, basically any other
So
supplement as of now.
we can check the label. So lactobacillus and bifidobacterium.
Yes, sir. And even
Yeah,
Saccharomyces
wonderful.
boulardii also.
And Saccharomyces. These we should check.
Yes,
So
sir.
thank you, Dr. Nikhil. Thank you. तो लफ्ज बहुत ही छोटा है, but thank you, शुक्रिया, धन्यवाद. And like we
Thank you
always
so much, sir.
conclude in हरियाणवी, थारा भला हो, सबका भला हो. जय हिंद.
Thank you so much, sir.